We're back here on this Sunday morning. Steve Cashel, Dr. Brian Cole. It's our Ask the Doctor segment on Sports Medicine Weekly. It gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Easy to submit a question. Go to our website, sportsmedicineweekly.com. On the home page, you're going to find a link underneath the photo of Dr. Cole and yours truly. On the right side of that home page, you click on that link and you submit your question. Got a good one here, Dr. Cole, from one of our listeners. And we always invite the listeners to ask us your questions. It's free advice from one of the best in the world, Dr. Cole. It says, Dr. Cole, following surgery to repair a broken bone in my wrist, my surgeon said I need to take a vitamin D supplement. I also hear vitamin D can help protect against COVID to a certain extent. Is this, Dr. Cole, your usual suggestion as well, following a surgery like this?
Well, it's interesting. Vitamin D's been in the public domain as it relates to sports for some time now. We now have a significant initiative, for example, in the NBA to assess vitamin D levels. A lot of our players were deficient, and we think that there's some benefit to improving bone healing, for example. We know that stress fractures that can occur through overuse are potentially more prone to occur in a vitamin D deficient individual, and that we know that replenishing it with the proper amount can be very important. When you take a sport, for example, like basketball, where they're not getting a lot of outdoor time, because the sunlight is what's critical to actually accumulate vitamin D, besides taking it as a supplement. So as it relates to this particular individual, certainly, there's a normal level. Vitamin D can be measured in a vitamin D blood test. The range is somewhere between, say, 20 and 50, and that's what healthy people should have, that range 20 to 50. And if you're less than 20, then that's considered vitamin D deficiency. And some of the things that can happen with that, Steve, it can be a loss of bone density, it can lead to osteoporosis or thinning in the bones, and we know that it can predispose people to fractures. And when it's very severe, it can actually, in children, for example, there's a condition you may have heard of called rickets. Very rare, but that's one when the bones actually get very soft and can actually bend. So what are some of the remedies to this? Certainly you can take a vitamin D supplement, which is inexpensive, it's very safe, and it's over the counter. Spending time in the sunlight. Vitamin D has often been called the sunshine vitamin because the sun is actually one of the best sources of this as a nutrient. There's other things like fatty fish and seafood and mushrooms and egg yolks and other fortified foods that have vitamin D. So I'd say the easiest way, frankly, is to take a supplement. Vitamin D is very important to help improve your immune system as well. We know now that there's some who have said that it can actually protect against COVID. So that probably relates to how it can upregulate and modulate your immune system. So super simple to get. You can get it in Whole Foods, but can also be easily obtained as a supplement through something that's over the counter.
And from what I understand, Dr. Cole, it's probably not enough in your old multi-day vitamin, right? It's really suggested to take a supplement.
Yeah, I guess it can be, but I would say that in this case, I would take my recommendation, and this is what I do, is I would just take, a 25. It's called 25 hydroxy vitamin D, and I would do a supplement. It's like 25,000 units, I think, would be a typical dose. But you can, and it's very safe, and you can't really overdose on it, to be honest.
Great stuff. We're out of time, Dr. Cole. Great show. We appreciate it. And stay safe, you, your family, your staff, and your patients. We wish them all the best.
Thank you. You as well, Steve. Talk to you next Sunday.
All right. That's Dr. Brian Cole. I'm Steve Cashel. Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Many thanks to our producer, Shane Reardon. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel. We say so long for now. We thank you for listening to Sports Medicine Weekly. We'll be back next Sunday, 7 a.m. Central, with a brand new edition of Sports Medicine Weekly, only on
670 The Score.
Have a great rest of your Sunday, everybody. Be safe.